New at 5 o'clock, a recent study says daily marijuana use is outpacing drinking. Based on data from the National Survey on Drug Use and Health, the study found while alcohol is still more widely used, 2022 saw marijuana use surpass high-frequency drinking for the very first time. The trend reflects changes in public policy, as most states, including Washington, allow for medical or recreational marijuana use. It remains illegal, however, at the federal level. Meantime, the Justice Department has formally moved to reclassify marijuana as a less dangerous drug. It marks a historic shift in generations of U.S. drug policy. The proposed rule recognizes the medical uses of cannabis and acknowledges it has less potential for abuse than some of the most dangerous drugs. So joining us now is UW physician Dr. Vin Gupta, also an NBC News medical analyst. Doctor, thanks for joining us tonight.
Thanks, Joyce, for having me. Good evening.
Okay, first explain, what does it mean to reclassify this drug? What exactly would that do?
Well, Joyce, this has been in the works for a while now, and there's been a lot in public health, myself included, that have viewed this as critical. It's moving it from what the Drug Enforcement Agency views as a Schedule I drug, the most controlled. Think of drugs like heroin, high addiction potential, no really medicinal benefits, we believe, to something called the Schedule III, a little lower down in the risk category. Schedule III drugs also are believed to have medicinal benefit potentially. And so this is allowing there to be less criminalization of the use around the use of marijuana, especially recreational use. Also, Joyce, critically, it's acknowledging that there's potential medicinal benefits. We know that this is the case, especially for those maybe battling cancer, that can increase appetite. And lastly, it allows us to actually study this drug using federal funds, which is critical.
Talk to us more about some of the medical benefits for marijuana.
You know, what we think more than anything else is somebody that's battling multiple chronic diseases, say they're in end-stage cancer, not putting on weight, that medical marijuana has use when it comes to stimulating appetite. Also, Joyce, critically, it could be used as an adjunct for pain control. And this is something that we've seen in places where it's regulated at the state level, like say in Washington state, for both medicinal and recreational use, that patients do have a perceived benefit. So now what we're saying is, okay, if it's going to be allowed at the federal level, not only can we start to do NIH-funded trials to really understand this piece a little bit better, these medicinal benefits, but we can have this 50-state approach, not just this piece-wise, what states choose to adopt it versus what states choose to restrict it.
So one would expect broader use if this reclassification happens. Opponents worry about addiction. What do you say to those who might worry about addiction to this drug?
Well, we need to learn more. This has been one of the big cons of how we've approached marijuana legislation all these many decades. We don't know. I think people can cite survey data, some small-scale studies that have not been scientifically done. This is going to allow us to do rigorous randomized controlled trials that are federally funded and allow us to have actual thoughtful regulation and scientific knowledge developed on this critical issue. We just don't know a lot. So this is going to be will allow us to gain some critical knowledge.
So with all of the benefits that you described, is there anything that you are most concerned about that would worry you?
There are some concerns. I'm a pulmonologist, and what we've seen, again, with these small-scale studies, not large-scale, not largely funded, is that there might be potential heart disease impacts. How does this impact the lungs? It took us many decades to understand the impact of cigarette smoke on the lungs. I'm not saying that there's an equivalent risk to marijuana smoke, but there are some early stage studies suggesting that there might be some injury potentially to the vessels around the heart. Is that real? We need to have larger scale studies. So some signals of potential harm, but we need to really bear it out.
Yeah, to understand both the benefits and also the risks. But like you say, we need more study, more time. Dr. Vin Gupta, thank you so much. We appreciate your time tonight.
Thanks for having me.